Hello, my name is Igor Sincos. I'm gonna show you today how we do thermal ablation here in Brazil, in São Paulo. We have a patient. She has 62 years old, no comorbidities. She has pain and heaviness in the leg. She has a history of bariatric surgery in the past. She's doing academy, she's on a diet, using stock, but she still have pain and edema in her left leg. She also complains of aesthetic problems. So today we're gonna do ablation of the left saphenous vein, and we do also the aesthetic applications and treatment of the spider veins in the same moment. In Brazil, most women, and because the health care program, sometimes we do all together, even both saphenous vein. We can do like rack anesthesia, but we also can do with local anesthesia. We're gonna do here with local anesthesia and the spider veins in the follow after the surgery, okay?
The first step, we do a scanning of the saphenous vein. Here we can see the SFJ, where we can follow the saphenous vein all the way down.
With some collaterals in the leg, tributaries, perforator vein. We're gonna direct this through this and do the ablation. We have the saphenous vein in the fascia here. Then we go all the way down to the knee. And in a certain point, the vein release its reflux to other superficial veins. So we decide to do the access in the G point here. So we're gonna start the access. To see the tumescent, we see here the catheter in the middle, bright, and we see the tumescent around the saline, around the vein, and then we check here in the place there is no saline. So we go here to the transition, and we try to do the tumescent insert the fascia. So we have this section going up, and the vein right in the middle. This is a very nice picture of what we need to do best to avoid some damage of veins, some damage of nerves and the skin. So this is the best tumescent inside the fascia, and you can see the compression of the vein with the tumescent.
The last tumescent injection we prefer to do on the longitudinal way, where we can see the tip of the catheter and the SFJ 2 centimeters away from the catheter from the SFJ. We do this tumescent looking the knee coming close to the junction, and then we're gonna insert the saline to try to close the junction, protecting the femoral vein from the heat of the catheter.
Trendelenburg and now compression, and we are ready to start the thermal ablation. Go on, please. We can check there the catheter, and we start in the ablation. To do the ablation, we can see in the monitor that we have a controlling of temperature automatically doing by the device. Always do 2 cycles per segment in the leg. We have 20 seconds of treatment each cycle. The energy is related to the temperature, so there is an automatically set up, and we can be sure that it's gonna be good, you know? Now we bring down the catheter to the next mark, and we do a second ablation. We prefer to do 2 cycles per segment in the tight. When we come close to the knee, we change for just 1 cycle at the end. While she's press the button and bring down the fiber, we still checking here if there is compression and the quantity of bubbles there is doing with the ablation With less bubbles, I think is better because there is a right completion and the Trendelenburg is okay, so it's less blood again. At this moment, we are doing the last ablation with these special marks to know where we are. So we're gonna do the last ablation. We have a chance to do one more, bringing down the sheet that I'm gonna show in the next step. So at this moment, we have a chance to do one more ablation. We bring down the sheet, and then we bring again the fiber, and we have a chance to do one more ablation here. Go on. This is the last one, and we are done. This is the fiber away from the sheet. We just finished the procedure. Now we're gonna do the aesthetic spider veins application, and the patient is gonna be ready to go home after a couple of hours. Thank you. See you next video.